Today the topic we are seeing is the cytokines. So under the cytokines, firstly the questions. The first question is, what is the IL-3 and what is its source? The second question is, what is TNF alpha? What is TNF alpha and what is its function? The question 3 is, what is the function of IL-10? So in this video, we'll find the answers to all these questions, and there is a bonus question in the end of the video. So firstly, we look at the IL-1. So IL-1 is nothing but the interleukin 1, and there is alpha and the beta. So what is the main source? The main source of this is nothing but the macrophages as well as the other cell types. Next, we look at the IL-2. So the IL-2, it includes the T cells. Then we look at the IL-3. So the IL-3, it also includes the T cells. What about the IL-4? The IL-4, it is also the TH cells, T helper cells. And what about IL-5? IL-5 is again the TH cells. Then moving on to the IL-6. So IL-6 is nothing but the TH as well as the macrophages and the fibroblasts. Then we look at the IL-8. So IL-8 is nothing but the macrophages and the others. Then we look at the IL-10. So IL-10 comes as the T B cells as well as the macrophages. So now we move ahead. So the next category, that is the pro-inflammatory cytokines. So under the pro-inflammatory cytokines, it includes the IL-1. The IL-1 includes it induces the inflammation. Then it involves the fever. Next, there is also the involvement of sepsis. And what this interleukin 1 does is that it activates the TNF alpha, and it causes the proliferation. It causes the proliferation and differentiation, and this is of the T and the B as well as other cells. It also leads to the bone marrow cell proliferation. Then we move on to the IL-2. IL-2 is also a pro-inflammatory cytokine. So the IL-2, what it does, it promotes the growth as well as the differentiation. So it promotes the growth and the differentiation of the T and the B cells, and post this, it also results in the cytotoxicity of the T and the NK cells. And there is also the secretion of the other lymphokines. Next, we look at the IL-6. So what is the IL-6? So the IL-6, it promotes the B stimulation. It promotes the B stimulation. and after promoting the B stimulation, as well as it helps in the differentiation, and it acts as a mediator. Interleukin 6, it acts as a mediator of the acute. It acts as a mediator of the acute phase reactions as well as the IgG production. Then we look at the IL-8. So the IL-8, it attracts as well as it activates. It attracts as well as activates the neutrophils in the inflammatory regions, and it also results in the neutrophil hemotaxis. Then we look at the IFN alpha. So the interferon alpha, it is nothing but antiviral. Next, there is the immunoregulatory. That is, it can result in the enhancement. Results in enhancement of the MHC. So this is the class 1 as well as the NK cell activity. Next, it also causes the anti-proliferative. Then we move on to the TNF alpha. So the TNF alpha, it is nothing but it activates the macrophage and also the cytotoxic cells. It induces cachexia and causes acute phase proteins, and it also results in cytokines such as the IL-1 as well as the IL-6. Next, we look at the heading of the anti-inflammatory cytokines. So under the anti-inflammatory cytokines, there is the IL-4. So what is the function of IL-4? The IL-4, it results in the proliferation. So it results in the proliferation of the B and the cytotoxic cells. And it also results in increase. It results in the increase of the IgG1 and the IgGE production. And it enhances the MHC class 2 receptor. So after this, in the anti-inflammatory cytokines, there is also the IL-10. There is interleukin 10. So this IL-10, what it does, it inhibits the IFN gamma and as well as the IL-12. So it inhibits both of their production, and also it inhibits the IFN production as well as the mononuclear cell function. Next, there is also IL-13, which is an anti-inflammatory cytokine. So we saw IL-4, 10 and now 13. So after this, we look at the acute acute inflammation and the sepsis. So under acute inflammation and sepsis, there is the IFN, TFN alpha, as well as the IL-1. Then we move on to the special cytokines. So under the special cytokines, there is IFN gamma. So the IFN gamma, there is granuloma formation. Next, it also includes the antiviral, and after the antiviral, there is also the immunoregulatory, and post this, so immunoregulatory, what it does, it enhances the MHC 1 and 2, as well as it causes the macrophage. It causes macrophage activation. And after this, interferon gamma, it also includes the anti-proliferative. So after this, there is TGF. We look at TGF beta. So TGF beta, it can result in the fibrosis, as well as it activates the macrophages. Then we look at the VEGF. So VEGF, what it does, it promotes the angiogenesis. Now we are going to find out the answers to all our questions. So the first question we asked was, what is the source of the IL-3? So the IL-3 source is nothing but it is from the T cells. The second question we asked was, what is the TNF alpha? So the TNF alpha is nothing but the function is it activates what it does, it activates the macrophages. It activates the macrophages and the cytotoxic cells. Next, what it does, it induces cachexia. It induces cachexia as well as the acute phase proteins. Then there is cytokines such as the IL-1 and the IL-6. So after the TNF alpha, this was the second question. The third question we are going to see is, what is the IL-10? So the IL-10, what it does, it inhibits the IFN gamma and the IL-12 production. And other thing is it inhibits the IFN production as well as and the mononuclear cell function. So now we move on to our bonus questions. So these bonus questions can be answered in the comment section. So bonus questions. The first one is, name some special cytokines. Second question, name some acute inflammatory cytokines. Then next question is, what are the pro-inflammatory cytokines. What are the pro-inflammatory cytokines? So these answers can be given in the comment section.